In Kenya, it's easy to raise money for a funeral than it is to raise money for a hospital bill. Stay with me here. I've thought this through. 1 in every 14 children in sub-Saharan Africa die before reaching their 5th birthday. This is 15 times higher than countries with high income. In Kenya, where more than 56% of the population live in poverty, diseases such as HIV, tuberculosis, and malaria leave hundreds of thousands either severely sick or sadly dead. The World Health Organization database show that out of the 619,000 malaria deaths reported in 2019, 96% of those were actually from sub-Saharan Africa. Children under the age of 5 accounted for 80% of all deaths in this region, despite the fact that most of those deaths are actually preventable. One of the main reasons that has led to these shocking statistics is lack of proper healthcare and healthcare financing systems. Majority of Kenyans finance their healthcare out of pocket, which becomes a costly affair against other competing needs such as food. According to FinAccess 2021, 54% of Kenyans indicated that they had at some point in their lives foregone healthcare simply because they couldn't afford it. Existing coping mechanisms such as use of savings, loans, and sale of property are simply not sustainable because they drive these communities deeper and deeper into poverty. Most of them are one health calamity away from absolute poverty. Those who do not have savings or property to sell turn to friends and family, a concept popularly known as Harambee, for contributions towards the cost of their healthcare. And as I mentioned earlier in the beginning, raising money for medical bills is an uphill task. Traditional health insurance penetration has remained low, with most insurance companies majorly focusing on corporate clients and those who are formally employed. Thus, the concept of insurance has been alien and elitist to the underserved communities. For those who have dared to extend this concept to these communities are often faced with rejection due to lack of trust and misalignment between community needs and the proposed solutions brought forth to them. Aware of these challenges, we decided to use a different approach. We came up with what we call a health financing staircase, a commitment roadmap towards financing for healthcare. So instead of going to these communities and disrupting everything they know all at once, we embedded ourselves within the community by starting off with primary research, followed by core design workshops and focus groups, where we immerse the community into the design of a sustainable, relatable, and feasible health financing solution using human-centered design principles. Once the product is ready, we use behavior science to introduce the community to a new way of financing their healthcare. Starting off with insurance literacy training, down to low commitment, low value products, such as telemedicine and wellness packages, all the way to high commitment, high value solutions, such as a comprehensive health insurance package for the entire family. In order to serve these emerging consumers effectively, we rely on technology for effectiveness and efficiency. We have introduced telemedicine where patients can consult the doctor virtually or even using a normal phone call. This helps keep the cost to the consumer low and affordable. Unlike traditional insurance, our solutions are simple, easy to understand, with little to no exclusions. Traditional insurance would ask you to pay in full upfront before enjoying coverage. This doesn't work with underserved communities. We allow our customers to pay for their subscriptions in installments, which match their income patterns, which are mostly irregular. We use peer-to-peer accountability to make sure everyone stays up to date with their payments. We believe that for us to achieve universal healthcare, we must first redesign healthcare financing in underserved communities, one community at a time.